Go ahead.
And about public health at the border, is the president concerned that migrants who are coming in great numbers are not being tested for COVID at their first point of contact with Border Patrol?
Well, let me give you a little bit of an understanding of what actually happens when people come across the border. First, as to Katie's earlier question, there's been no change in Title 42, so families and single adults are expelled, if possible, when apprehended at the southern border. That's step one. Those who can't be expelled are often placed, and this is, I think, goes to your question, in alternatives to detention programs while their cases are being reviewed. CBP provides migrants with PPE from the moment they are taken into custody, and migrants are required to keep masks on at all times, including when they are transferred or in the process of being released. Our other protocol is if anyone exhibits signs of illness in CBP custody, they're referred to local health systems for appropriate testing, diagnosis, isolation, and treatment. That is our process.
Okay, and then just about COVID safety, is President Obama setting the wrong example about how serious COVID-19 is by hosting a big birthday party with hundreds of people this week?
Well, I would certainly refer you to the team who is working for my former boss to give you more specifics of what the protocols are in place. But I would note first that former President Obama has been a huge advocate of individuals getting vaccinated. When CDC what CDC has provided guidance on is for indoor settings in high or substantial high zones of COVID cases. This event, according to all the public reporting, is outdoors and in a moderate zone. But in addition, there is testing requirements and other steps they are taking, which I'm sure they can outline for you in more detail.
But is there any concern, just because, as you've said here, and you've had people saying over the last couple of days, vaccinated people can still spread this Delta variant around. So is there concern that this President Obama birthday party might become a super spreader event?
Well, I think, Peter, the guidance is about what steps people can take when they're in public settings. Indoor settings specifically was the new guidance to keep themselves and others safe. In terms of what protocols they are taking, I would refer you to them, and I'm sure they can give you more details.
And just last one. So people who are watching this at home and they see, well, President Obama can have a party with several hundred people. Should they think that it is okay for them to have a party with several hundred people now?
Well, we certainly advise everyone to follow public health guidelines, which I know the former president, who is a huge advocate of getting vaccinated, of following the guidance of public health experts, would certainly advocate for himself as well. Go ahead, Kelly.
Senator Lindsey Graham has announced that he has tested positive for COVID after being vaccinated and will be doing some self-isolating, which could have an impact on, for example, the bipartisan infrastructure. So what is your reaction to that? And secondly, does the administration feel like they need to get more sources of information on breakthrough cases, given the anecdotal experience many people are having of seeing more incidents of that, beyond just the issue of hospitalizations and deaths, but more information about how much the breakthrough cases are spreading?
Well, let me first say that every single piece of available evidence shows that breakthrough infections are rare and mild, and that is according to a range of data. So according to new research from Kaiser Family Foundation from January to July, the rate of breakthrough cases reported to states is below 1%. We've seen data come out from England, Scotland, Canada, and Israel showing that vaccines are about 80% effective in preventing illness from Delta and about 90% effective in preventing hospitalizations by Delta. CDC is actively tracking tens of thousands of people in cohort studies, as I think you know, and we've talked about a little bit in here. Some of them doing weekly PCR testing, which includes healthcare professionals, first responders, hospitalized adults, and people in long-term care facilities. Also, states and hospital associations are reporting their own data. Now, we know there's an interest in getting that data. We support that. Dr. Walensky says that they plan to release that as well, which we, of course, support as well, and it's important for you all to look at. But I would note that, and I thought this was important because if you look at the power of vaccinations, you're looking at specifically the numbers of, according to 7-day averages of January versus July. January is, of course, the lighter numbers, and then the darker number is July. And if you look at hospital admissions and deaths, this is really because of the impact of the vaccine and how effective it is at preventing people from being hospitalized and dying from COVID. We certainly do hope that Senator Graham has a speedy recovery and experiences mild symptoms, and we wish him the best of health through that.
In places like Florida, where hospitalizations are at a record level,
Yeah.
Is there any concern about the number of resources available, rationing of care, additional equipment that needs to be sent in, or personnel to assist?
Well, one, we stand ready and available to provide any assistance that is needed, whether that is Florida or any other part of the country. We've done these strike forces. We are at a very different point in the pandemic than we were a couple of months ago. We have ample vaccine. We have ample experts. We have ample resources to provide them. I will note, as you touched on there, 20% of the cases we're seeing are in Florida. There are steps and precautions that can be taken, including encouraging people to get vaccinated, encouraging people to wear masks, including allowing schools to mandate masks and allowing kids to wear masks, which is not the current state of play in Florida. So, at a certain point, leaders are going to have to choose whether they're going to follow public health guidelines or they're going to follow politics, and we certainly encourage all governors to follow the public health guidelines.